Okay, we have an abdominal exam, so I'm going to start by auscultating vowel sounds, starting in the right lower quadrant and going clockwise. A normal finding would be 5 to 30 vowel sounds within 1 minute. So I would listen for a full minute. Then I'm going to auscultate the abdominal aorta, which I would find to be right in like underneath the sternum and between the umbilicus and the sternum, listening for bruits, which would suggest hypertension, which I do not hear. Then I'm going to listen on either side for the renal arteries, also listening for bruit, which I do not hear. Then I'm going to percuss the abdomen. I'm going to either hear tympany, which would suggest like just air, or dullness, which would suggest an organ or just stool. So then to assess where the liver is, I'm going to start at the right lower quadrant. I'm going to percuss. I'm hearing tympany, and then at the bottom of the liver edge, I'm going to hear dullness. Then I'm going to mark that here, and I'm going to start above the liver here, and I'm hearing resonance on her lungs. And then once I hear dullness, that's the top of the liver's edge. 6 to 12 inches is normal. Then for the spleen, it's going to be lower underneath the left subcostal, border. So I would hear dullness there underneath the spleen. Then I'm going to use palpation, so light palpation to feel any masses, tenderness, or loops of bowel or stool. Then deeper palpation, same thing, just for any masses or anything abnormal. Then I am going to palpate the liver itself and feel, so just try to take a deep breath and relax. Great, so I can feel the liver's edge here, and then I'm gonna go underneath here and find her spleen. If I had difficulty doing that, I could have her lie on her side and kind of bring the spleen a little bit down. Then I did light palpation and deep palpation, palpated the liver and the spleen. Then I'm going to assess the psoas. So I'll have you uncross your legs. I'm going to put pressure on your thigh, and I'll have you lift up your right leg. And do you feel any pressure in your pain in your right lower quadrant? Mm-hmm. No, but if you did, that might be a sign of appendicitis. So I'll have you, next I'll have you lift up your leg and turn it in. And this is the obturator test. So again, any tenderness in the right lower quadrant might suggest appendicitis. Then I'm going to assess the aorta. So I'm starting in the middle here where I feel this little slight pulsation. I'm going to slowly move my fingers out, and it's about 2 centimeters, which is a normal finding. You want to make sure it's less than 3 centimeters. Lastly, for our special maneuvers, Christy, I'll have you sit up and face this way. Awesome. I'm going to then palpate the flank on the sides here, and for any tenderness or masses, so no tenderness, that's great. Then to test for pyelonephritis, I'm going to use put my hand at the costovertebral angle here and pound, and if there's any tenderness, then that might suggest pyelonephritis. Okay.